Most large employers have an employee assistance program, but for the 33,000 employees across the Henry Ford Health System group, they've taken it one step further. Paula Tutman takes us inside that group to show how they are working to retain healthcare workers by addressing their mental health needs.
Healthcare workers on the front lines and even behind the scenes are bracing themselves for what they believe could be coming next, and that is another COVID surge. Now, we're hearing about burnout, frustration, even experienced people leaving the field, which is why what Henry Ford Health Systems is doing really caught our attention.
It was a group that didn't exist prior to COVID. And immediately there was recognition, oh my gosh, we are going to need to put resources in place to support our employees if we are going to get through this medical crisis.
Yes, employees were in crisis as the pandemic grew.
We saw, in addition to high anxiety, lots of fear, a sense of powerlessness, a sense of feeling tired and burned out, sadness, insomnia and an inability to sleep.
A new kind of employee assistance outreach you could call EAP on steroids sprang up in March of 2020. The behavioral medicine department put together a toolkit called Recover and Heal just to deal with healthcare worker trauma. In the toolkit, the Stronger Together Buddy System. Currently, there are 150 buddy pairs, from janitors to orderlies to nurses, doctors, and administrative executives supporting one another so that what happens at work doesn't necessarily spill into households and infect partners and children to the stressors of the day.
It's really colleagues helping colleagues. And they make a commitment to hold each other up on a daily basis, either via text or email or phone call for a 12-week period.
The care cart moves throughout facilities daily so that employees can grab a healthy snack, have a friendly ear to talk to, or even sound an alert that they need deeper, more comprehensive services. And then for peer processing groups, a team of mental health professionals will, I guess you could say, parachute into any given facility when a team leader notices acute stress crisis in their units.
We meet with small teams, usually around 5 to 10 people. It's co-facilitated by the leader of that particular area and one of the members of like a COVID counselor or mental health professional. And they lead this small group in a conversation about what they're experiencing. That then opens a psychological safety in the entire group beginning to really open up and find that we all have a shared narrative. We're going through this together. How can we support each other? What are some coping strategies that have helped you? Or what are some things that have actually made you feel worse? And then the mental health professional guides them into a further conversation about something we call post-traumatic growth.
The thing is, with burnout comes dropping out. And if we start losing experienced healthcare workers because their physical and emotional tanks are empty, the already serious pandemic becomes even more serious. If you roll up to a hospital, no matter which hospital group we're talking about, and no one is there to admit you, roll you down the hall, or hook you up to life-saving measures. And so the Recover and Heal program deals with past grief and trauma, post-traumatic trauma and stress, fear of what's coming next, and real feelings on the ground being experienced right now as new COVID patients hit the wards.
I think universally, healthcare workers are struggling with compassion fatigue. And in the context of that, there is conflict in, I'm here, I've been here, this has been going on for a long time, I'm exposing myself. When they are on the front, putting their lives at risk, and now patients are coming in who have not been vaccinated, and they say, why do I have to continue to be exposed to this when others within the community aren't doing their role?
Here's the bottom line. When you are saving the mental, emotional, and spiritual health care of your workers, they are able to continue to save us. Paula Tutman, Local 4.